This presentation is about the effects of ionizing radiation and operator and patient protection. The presentation is geared toward the dental assisting student. The effects of ionizing radiation. Remember ionization, which was in a previous slide presentation? Ionization is when ions are produced in cellular structures of tissue when exposed to dental X-rays or to X-rays, radiation, and this causes biological effects. The biological effects depend on the amount, the dose of radiation that a tissues of a person are receiving, the frequency, how often they are receiving radiation, the sensitivity of the cells. So we have different cells and tissues and organs that are more sensitive in our bodies than other tissues or cells. And the cumulative effect, meaning repeated exposure, affects tissue and tissue function. The operator and patient protection, so to minimize the effects of radiation, we can do this with our X-ray equipment, with shielding, with exposing techniques, or standards in working with radiation. Let's look at equipment and shielding. So we always want to make sure that our dental X-ray unit is in good working order with periodic inspections and periodic quality control and quality assurance protocols. If we use digital sensors, it is known and scientifically proven that digital X-ray systems reduce the amount of radiation to the patient. So we want to make sure that our sensors are in good shape and our digital software is in good shape. If you're still using film, then you want to make sure that you have ultra speed film, or of course F-speed film, and that your processors are in good working order, that your chemicals are new or fresh, that your processor is replenishing at proper levels, that the temperature of the water and the dryer of the auto processing unit is also proper. Shielding is very important for our patient protection and we as the operator. So we are required in most states for the patient to wear a lead or lead equivalent apron to protect them from radiation. Your apron should have a thyroid collar because the thyroid is very sensitive to radiation. It will affect the thyroid easily, and we are also protecting the reproductive system, no matter how old the patient, of course for the future in this case, but protecting the reproduction system. Also, if you are working with pediatric patients and they will work with you better if the parent or a guardian is holding them, then you need to protect that parent or guardian as well. For the operator, we use either shielding from the walls, which will help to eliminate X-ray exposure or radiation exposure. We stand out of the line of the direct beam of the X-ray. You can even think of it as the PID, but also for any scattered radiation or secondary radiation that may be deflected. So where we stand in position or in relation to the patient and the PID is very important, and we must be at least 6 feet away from the source of radiation. That will also protect us. Exposing techniques. So using good technique as far as PID position, image receptor position to avoid retakes. You can use either the bisecting or the paralleling technique, but you must use it properly. If you're using an image holder, you have to make sure that you are actually putting it together properly in order to avoid retakes. Also, in using digital, you want to be aware of the cord of the sensor so that doesn't interfere with your image, which would warrant a retake. Also, placing either the film or even the digital sensor backwards in the patient's mouth, that would warrant a retake. So all of those would be faults in our exposing techniques. We never want a patient to hold the image receptor with their hand because then their hand is being exposed to radiation. Nor do we want to hold the image receptor for the patient, no matter how old or how cute they are. Here, this little girl, we do not want to hold it because we work around radiation every day, in most cases, as dental assistants. We want to implement standards when working with radiation, and one of those standards or principles is known as ALARA, and it's an acronym that stands for as low as reasonably achievable. That means that we want to use exposure settings that minimize radiation exposure to the patient. One of the easiest ways to adjust our dental x-ray unit for exposure is with the time. In a previous presentation, we did look at the milliamperage and the kilovoltage, but the easiest control or setting on the x-ray unit to change is the time or the impulses. That will reduce radiation exposure. Another standard is the selection criteria. And from guidelines from the American Dental Association, a term that is being used is that prescribing is evidence-based or prescribing as needed for dental examinations, for treatment, or post-operative care. So instead of directing dentists that x-rays can only be taken bite wings every year or a full mouth every 3 to 5 years, they really are leaving it up to the expertise of the dentist and the ethical decision making of the dentist to use evidence for prescribing x-rays. And so only a dentist, and in some states maybe a dental hygienist, can decide whether a patient actually needs x-rays, and it should be for examinations, for treatment, whether it's an emergency or other treatment or post-operative care. So those are the standards that we use, ALARA and selection criteria. Another area of operator protection is to have radiology monitoring. This can be done by a film badge, which there's actually radio-sensitive film in this badge, and you purchase these from a company and then you send them in periodically, usually it's monthly, and they will test the film to see how much radiation exposure the radiographer is receiving. Some of the newer ones are this type of dosimeter where it's direct ion storage, and so it's radiation exposure. It's actually stored and it's then read via a USB device, and so the USB is within this dosimeter. The unit of measure for the amount of exposure is called the sievert, and we should be dealing in microsieverts. So how much radiation can one be exposed to and still be protected? For an operator, so if you are in dental or medical, The maximum permissible dose is 50 millisieverts per year. For the general public, for what they call incidental or accidental exposures. So these are exposures that are not necessary for medical or dental procedures. The maximum permissible dose is 5 millisieverts per year. So exposures, remember though, are cumulative because it makes a change in body tissues. So we do have to be very careful, and really it's the dentist who is directing when patients are to receive or to have x-rays. And of course, that also affects us as the radiographer because we're the ones taking the x-ray. This is a kind of a radiation dosage chart. And, we receive radiation from a number of sources. We looked at the electromagnetic spectrum, and we can see where we do receive radiation from a lot of sources. Even some of our food is radiation as it comes into our country. Our food is radiated. So I'm just going to leave that to you to look online, look in your textbooks for different levels of radiation from various sources. Equipment and protocols to protect the operator. You should seek information from your Department of Public Health, or the radiological branch or health branch in your area. And they are a good source for information. They will perform inspections without it coming to you to give advice, not to actually write you up for violations, but they are helpful and have a lot of information. Probably in most states, your dental radiography unit must be registered. You should have periodic inspections by not only the Department of Public Health, but by a physicist to make sure they have special testing that they do to make sure your units are in good working order. You should have some quality assurance and quality control programs in place in your office, reviewing your radiographic images for quality, deciding what to do when they are not of diagnostic quality, maybe some training to implement new protocols or new techniques, or even a review. And in some states, you're required to have a radiation protection program where you're actually writing down what you do in your office for ionizing radiation protection for the operator and the patient. So thank you very much for listening to this presentation on the effects of ionizing radiation and operator and patient protection.